Hey guys, the Medicaphilic guy here. I am starting system-wise lectures in which I will make videos in a sequence, starting from embryology, then anatomy, physiology, pathology, and finally pharmacology of a specific organ system. And today we will focus on heart anatomy because the first system I'm going to cover is cardiac system. Heart is a muscular conical organ that pumps the blood to the body. It is about the size of a person's fist, 12 centimeter long, 8 centimeter wide, and 6 centimeter thick. The average human heart weighs approximately 250 to 350 grams, a stunning exemplar of precision engineering in the human body. Coming towards its position and orientation, the heart is present in the middle mediastinum of thorax, slightly on the left, resting on the diaphragm, behind the sternum, anterior to the vertebral column, in between the lungs at the level of T5 to T8. Heart lies in the thorax like a pyramid that has fallen over. The apex of the pyramid projects forward, downward, and to the left. Heart has 5 surfaces. A diaphragmatic surface, which is on the inferior side and consists of left and right ventricles. An anterior surface, also called sternocostal surface, which consists of right ventricle. A posterior surface, which is the base actually, and the left atrium is present on this surface. And lastly, the right and left pulmonary surfaces that consist of right atrium and left ventricle consecutively. The heart is enclosed within a double-layered sac called the pericardium, comprising the fibrous pericardium and serous pericardium. The fibrous pericardium, composed of dense, tough connective tissue, anchors the heart in place and prevents overfilling. The serous pericardium consists of 2 layers: outer parietal layer that is attached to the fibrous pericardium, inner visceral layer adherent to the outer cardiac layer, forming the epicardium. Both parietal and visceral layers secrete a protein-rich fluid called pericardial fluid, reducing friction between the heart and surrounding tissues. Let me show you the serous and fibrous pericardium visually. Now, if we cut the heart like this and zoom in this small segment, we will see the 3 layers of heart wall, the endocardium, myocardium, and the epicardium from in to out consecutively. The innermost is the endocardium, which is lined by endothelium, just like blood vessels, and is in direct contact with the heart. At the valve, it forms double layer of endocardium that is actually the cusps of the valves, or in simple words, endocardium makes the cusps of heart valves. Moving on to myocardium, it's the thickest layer actually responsible for pumping of the blood. Its thickness varies, and it is the thickest in left ventricle because it has to pump blood to the whole body. It consists of myocytes supported by collagen fibers. Remember, the coronary vessels which supply the heart lies in myocardium. Myocardium forms the fibrous rings around the valves, thus it actually separates the atria from ventricles. Epicardium is the outermost layer. It's not actually the part of the heart wall, but since it sits so tightly at myocardium, so it is considered as the outermost one, and it's actually the visceral layer of serous pericardium. Please like, subscribe, comment, and support.